Hello, my name is Mirvat Alasnag and I want to welcome you to day 2 of the National Heart Forum that is being conducted here in Riyadh, Saudi Arabia. And I have the immense pleasure of having Dr. Zakariya bin Mousa, who is the director of the non-invasive laboratory at Prince Sultan Cardiac Center, and he is a structural interventionist. Dr. Zakariya, thank you for joining us today.
Thank you for having me.
So I know you had a important role in the scientific committee selecting the topics that we want to cover from the perspective of interventional imaging. Talk to us about how you chose the topics and what topics you chose to be covered this year.
I think from working on the field, or especially with the structural intervention, we try to find the gaps practically in the field of imaging, especially the aortic stenosis field. We're facing some on daily practice conflicting data regarding the diagnosis of severe aortic stenosis, and we thought we would have to concentrate in this topic as part of, collectively to improve the diagnosis and then also to improve the outcome. That's the first topic we thought we have to concentrate on. The second is the 3D echo. We know that that improvement structural intervention, especially in the field of the mitral valve intervention, has gone, it improved and it progressed after the improvement of 3D. And we thought that we need to improve this gap. The people, those who are working in the imaging field, they have to be more competent, more expert in a 3D echo, whether it's acquisition, cropping, and interpretation. And the third topic was the POCUS, point of care ultrasound. And I believe the ultrasound now is becoming like the new stethoscope of the physician. So it's widely used in different parts of the body, not only the heart. It can be used in the abdomen, in the lungs, and for diagnosis of masses. It's really becoming very popular and has a lot of utilization in the journey of the diagnosing the patients with any problem, whether it is in the emergency room or in OR, in clinic. So we thought that this is an important topic. We try to give specific. We cannot cover everything, but we concentrated on the most important topics related to the cardiology, like the LV function, shock patients, and then the pulmonary embolism, and finally with the lung scan related to the cardiac conditions.
Very impressive. And I also noticed that you are including the entire team. So you're training up the technicians or sonographers, you're training up the physicians, and you're also training up the fellows who are still during their fellowship programs.
Yeah, so definitely, if you want to have a better, let's say, work collectively, you have to improve your team, whether it is the technician or the fellow or the consultant, because specifically for the ultrasound, it's operator dependent. So whatever the technician or the fellow will do, it will be reflected in your report and your decision as a consultant. So we try to involve everyone, and we are working to make it more feasible and approachable for every aspect or every member of the team. As I said, like the ultrasound is becoming the stethoscope, and everyone that work with the patient has to be I mean, if he's working with the ultrasound, we're working to make him better.
So, aside from the forum, I know that you are one of the few with expertise in mitral valve transcatheter procedures, and you are one of the interventional echocardiographers who has had specific training in it. Where do you see this field heading?
I think it is progressing very well. It's really demanding, and I'll tell you that I'm spending something like 30% or 40% of my daily work just looking at the images for mitral valve, tricuspid valve, and analyzing and meetings to decide about patients. So yes, I can see there is a high demand for those patients in the field of interventional cardiology, and I know that echocardiographer is an important part of this. It's no decision can be made without the input from the echocardiographer. So I'm trying to involve everyone from my colleagues. A general echo is important member of the cardiology team, but special training for those they are interested in the structural intervention. It gives me a different understanding of the mitral valve. I can tell you that my knowledge, my understanding of the mitral valve a few years back compared to now is totally different. The more you work with the mitral valve, the more you understand that you need more. So it's demanding, and I can see that there is a lot of demand for people to get involved in this field.
And not only is the volume of these cases increasing, but I think that the landscape of transcatheter therapies for mitral and tricuspid is changing very quickly. We're getting new valves, we're getting new technologies, and it's probably important not just for the interventional cardiologist, the operator, to learn the devices, but it's equally important for the interventional echocardiographer to understand the intricacies of these technologies and what to be looking for, so that we get better outcomes, as you said. I want to thank you very much for joining us today, and hope to catch up with you next year at the same time to discuss more in depth on valvular interventions. Thank you for staying tuned with us, everyone.